on that page.
Did he lie to us before?
I think he might have.
I don't know, I wasn't listening.
Good afternoon, everybody. It is 3:05, and I'd like to bring this meeting of the Kane County Board to order, please. It's Tuesday, July 18th. Please, clerk, please call the roll.
Allen present. Bates. Berman,
Berman's there.
Doherty,
Already present.
Davis,
Davis here.
Ford,
Ford present.
Gums,
Here.
Iqbal,
Clark present.
Juby,
Here.
Kenyon,
Here.
Caius,
Present.
Leonard, Lewis,
Who's here?
Linder,
Here.
Lena, Roth,
Out here.
Sanchez, Silva,
Here.
Strathman,
I'm here.
Surges,
Burgess here.
Tarver,
Tarver's here.
Pepe,
Tepe here.
Williams,
Williams here.
Young. You have a quorum, Madam
And
Chair.
I would like to ask permission. Gary Doherty will be attending remotely due to his illness. Do I have your permission to admit him into this meeting?
Yes.
Mavis Bates is currently, I believe, on holiday. She has graciously joined us to listen during that period of time. So she will be listening only since she's on personal leave
But not voting.
and not voting. We're wishing you a great vacation.
Is from holiday.
Oh, she's not here from holiday. She's back. Welcome. I thought you were on a holiday.
I'm supposed to have something with my husband this afternoon. Here instead.
Well, welcome,
Oh,
welcome.
Took the place of her husband.
Well,
tell us
welcome
what
Ms.
it was.
Bates.
Something.
It was a holiday.
All right, so Mr. Tarver, can I ask you to lead us in the pledge, please?
Like a veteran.
Flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
There are no minutes to approve at this meeting. I would like to move on forward now to public comment. As a matter of protocol, we ask that speakers refrain from statements, remarks, or conduct that may become disruptive to the conduct of the county board or which might cause a disturbance. I believe there is one public comment on agenda, and you will be allowed to speak for 5 minutes. If anybody is here to speak a matter that is not reflected to the agenda, we will obviously welcome your comments after the meeting, and you will be allowed to speak for 3 minutes, not after the meeting, but after the consent agenda is over with the work of the board. So with that, I'd like to move to our speaker that I am aware of. Okay, very good. We have one speaker today, Catherine Valerio.
From the state's attorney's office, I put in a submission to speak yesterday. So as board members, you're tasked with coming up with an annual budget, and health insurance is a large expense in that budget. Can you hear me?
No, put the mic by your.
Room, but online, they
Please.
probably need you to be,
Do I need to pick this up?
or the one there on the.
All right, this one? How's this?
Yes, there you go.
Uh,
Much better.
Health insurance premiums have a monetary value. Hopefully, employee satisfaction and retaining employees with the county also has monetary value. In addition to health insurance, this board is also currently determining whether the salaries of the Kane County attorneys are competitive with surrounding counties. Now, I've worked for this county for 25 years. I have seen countless attorneys and support staff leave jobs they love at the state's attorney's office for jobs paying more. They merely need to leave this county to go to any of our surrounding counties for a similar job paying more. This is especially.
Catherine, I don't mean to interrupt you, but are you going to talk specifically about the matter at hand,
I
which is
am.
health insurance?
I am, and this is part of the reason.
I'm sorry, can we have you move your microphone just a little farther over and then, yeah, wrangle it in there. You go. Now down toward your mouth.
Like a rock star.
Or own
Yeah,
it?
you gotta get
All right.
American
There, I
Idol.
think
Better?
that might do it. Yeah, thank you.
I don't have to hold it the whole time, do I?
No.
Oh.
Just speak
Up to
into
you.
it.
This leaving is especially prevalent with young assistant state's attorneys. Once they start to raise families, I just got notice of another young and talented assistant state's attorney, high-level felony experience, murders, other high-level felonies, leaving our office to go to McHenry County. She'll make more money. She had to leave. She has 2 children. I'm not even talking about the substantial increase in pay can be accomplished in private practice. Now, something the state's attorney's office can offer that sweetens incentive for employees to stay is the pension and good insurance. We lose many promising ASAs to private firms, but something that entices people to stay is the insurance, good insurance, because many private insurance or private firms, while paying well, offer poor or no insurance. So I reached out to several attorneys, paralegals, and support staff in our office, 7 in total, and here in no particular order are some of their concerns. 1, from a high-level non-attorney employee, stated, I have a Blue Cross Blue Shield HMO called Blue Advantage, and I'm covered by a specific HMO group called Advocate Aurora. Will I be covered? And I consider the excellent level of care offered by Blue Cross Blue Shield to be part of my compensation for working here at the state's attorney's office. Will any new insurance coverage offer the same level of excellent care? A second employee, a senior attorney with the state's attorney's office. I have children. I recall that when we previously had United Healthcare, I was not satisfied with their level of coverage. I want to keep Blue Cross Blue Shield. And third, another senior attorney with children said he likes Blue Cross Blue Shield coverage and knows what's offered, doesn't want to change it. He's very busy and trying to navigate a new healthcare system would be costly time-wise. A fourth employee said that she took a pay cut years ago to come from her former employer because she was attracted by our Blue Cross Blue Shield insurance coverage. A fifth person, another senior attorney, is familiar with Blue Cross Blue Shield, wants to keep it, and is afraid that another coverage might not be as complete. A sixth person, a younger attorney, said she's now familiar with Blue Cross Blue Shield, likes what it offers, wants to keep it. 7, another high-level employee said when she came to work at the state's attorney's office from another employer, it was at a time when we previously had United Healthcare. Her longstanding doctor dropped her as a patient because United Healthcare did not pay bills timely. Now, these are just 7 persons I spoke to. They all consider good insurance to be a value add to their what would otherwise be low compensation. And as for myself, I'm originally from Chicago. I have many long-term healthcare providers, some of them based in Chicago. I have them located in different locations. Will they be covered? Will I have to lose my medical coverage of many years? Everyone and myself wants to keep Blue Cross Blue Shield. They consider it a value add to their salaries. Please keep Blue Cross Blue Shield. Thank you.
Thank you. I believe that is our only public comment. And with that, I would like to have your permission because of a timely matter that'll be pertinent to our further conversation to move into executive session. We'll change the agenda to have executive session come first.
Surges.
8 seconds.
Thank you. And well, I'd like to make the motion. Mr. Tepe, we need to know why Mr. Tepe will present the.
Madam
language
Chair, I'd like
first.
to move that we go into executive session to discuss contracts.
Okay, very good. You second.
Surges.
Thank you, Mr. Surges. Please call the roll.
Allen,
Alan, I.
Bates,
Bates, yes.
Berman,
Oh, yes.
Doherty,
Yes.
Davis,
Davis, yes.
Ford, Gums,
Comes, yes.
Iqbal,
Yes.
Juby, Kenyon,
Yes.
Caius,
Guys, yes.
Mr. Leonard, did you arrive? Lewis,
Lewis, yes.
Linder,
Linda, yes.
Lena,
Sure, our state's attorney didn't have anything to say.
Yeah, that's, Mr. Frank, are we all right?
The issue is that it can't be for contracts, but it can be for collective negotiation matters.
You can't, I can't hear a word you're saying, please.
So you guys can go into executive session, not for contracts, but it has to be for collective negotiation matters would be a enumerated reason for why you can. So that's what it needs to be
I'll
for.
amend my second.
Mr. Tepe,
For collective negotiation matters regarding. Period.
period.
Regarding the issue at hand, which is the healthcare decisions.
Healthcare.
Okay, very good. So how do we have to start the roll call over again. So we have a motion and a second. So
Start it over again.
start over again, clean slate.
Okay, let's do this again. Alan,
I'm sorry.
we're taking the roll again.
To go into executive session.
No, to take,
This is a roll call of the motion to go into closed.
This is a yes or no.
Change the
As-
motion.
Didn't we already? Okay, I thought
Yes
we
or
already.
no?
Starting the roll call
Do you-
again.
Would you
Okay.
like to go into executive session?
Change the vote.
Thank you, Attorney Shepherd.
Okay.
Alan, I.
thank you. Bates. She stepped away.
She's in the back there.
Berman,
Yes.
Doherty,
Doherty, yes.
Davis,
Davis, yes.
Ford, Gums,
Gums, yes.
Dickwell,
Yes.
Juby.
Aye.
Kenyon,
Yes.
Caius,
Yes.
Lewis,
Yes.
Linder,
Linda, yes.
Melina,
Molina, yes.
Roth,
Roth, yes.
Mr. Sanchez, did you arrive? Silva,
Yes.
Strathman,
Strathman, yes.
Surgis,
Burgess, yes.
Tarver,
Carver, yes.
Tepe,
Deputy, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Ms. Bates.
Yes.
Thank you. Passes.
We have a motion and a second, and it's been approved to go into executive session. So
Okay, everybody online, please accept your invites to go into closed session. Be aware we are live streaming until I give you the okay. So please accept those invites, even if you are joining us in the room with your computer.
Have we directed who's staying in the room?
Yeah, we will do that. And for the record, I assume the state's attorney's office and the insurance personnel, what's, are there gonna be? two
Mr.
different
Baker.
presentations?
But he's doing both, Mr. Baker.
I am waiting, never mind.
Insured partners.
Never mind.
Okay, cool.
Who's never mind?
We
Molina, Roth here. Sanchez, Silva.
Here.
Strathman, Surgis, Tarver, Tepe, Williams.
Williams here.
Young.
Young here.
I'm Jerry. We're here as well. Active here. No, I just. We need to identify, Mr. Doherty, could you please identify yourself, please? We need to see your photograph. We're here. We need to see you.
Wish I could. Device, so I'm here.
Um, we also need to identify those individuals who have this.
Ken Shepro, State's Attorney's Office Assistant Parliamentarian.
Assistant State's Attorney Don Truce with the State's Attorney's Office. Why don't you just call everybody's name? Let's just say John Frank, Aaron Brady, Perlow, Mike Baker, Kathy Hawkins. Thank you.
The purpose of the closed session is for the purpose of discussing the collective bargaining related matters.
Thank you. I'm here today just to bring light of an issue that could be impacted by the change in providers. The likelihood of it happening, I cannot tell you, but it's just something to think about. When, there are quite a few CBAs out there, and you would be changing a provider during the course of this collective bargaining agreement and changing from Blue Cross Blue Shield to possibly United.
Stop.
Davis, your phone. Yeah, I think it was Davis's call. Still here online.
Off. I didn't know it was still on.
That was exciting. I don't know. Your microphone is not muted on Zoom.
I'm on there now.
It doesn't show you're muted.
No, I'm not on. I don't have audio on at all. That's by decision.
Oh, that's great.
Because I don't need.
That was just crazy. Coming in, I was listening.
Oh.
That's for YouTube. That's for YouTube.
Like maybe he's checking to make sure we're not on stage, but it's not, the audio's not coming through. We are on YouTube. Well, it's not on. I think you stay on there, but it stays blank.
Yeah,
It's YouTube. When I
just says this.
yeah, it's all it says, and you don't get audio.
Yeah.
So he has to check, make sure. audio's not-
Yeah.
That's why I give it back to you.
Somebody was having a graduation party. They had a
Those poor
tackle
people
one.
had
It
to
was
sit
really
there.
good.
Where?
Just to get their thing.
It was at their, they did it at their house. The tackle truck pulled up on the street right outside their house. and
One's coming in.
Insane.
Yeah.
The stuff from the truck was good.
Yeah.
Well,
I got a card somewhere. I don't remember the name of it now, but I got the guy's card, so.
All right, you are in open session.
All right, ladies and gentlemen, we're back in open session. Clerk, please call the roll.
Ellen,
Ellen present?
Bates,
It's here.
Berman,
Herman is here.
Doherty,
Doherty.
Water, Davis,
Davis here.
Ford, Gums,
Here.
Iqbal,
Present.
Juby,
Through here.
Kenyon,
Here.
Caius,
Guy is present.
Leonard's not here, Lewis,
Who's here?
Linder,
Here.
Molina present.
Roth. Okay.
Body break.
Sanchez, Silva,
Silva's here.
Strathman. Here. Surgis,
Surge's here.
Tarver,
Tarver's here.
Tepe,
Deppie here.
Williams,
Here.
Young.
Young here.
You have a quorum.
Have a quorum. Well, very good. All right, we are now back to the business of the board and onward to discussion. Perhaps, Ms. Labrillo, you can come up and introduce the two topics that we're going to start with and introduce Mike Baker.
Thank you. As we have presented, there are two resolutions in front of you. One authorizes the current provider, Blue Cross Blue Shield, as the county's group health provider. The other authorizes United Healthcare as the county's group health benefit provider. As we have been discussing that, we do have Michael Baker here from Assured Partners. He is our broker for health services, and he can provide information regarding the potential disruption as well as the cost savings associated with any changes that are made, and can answer any questions for you. One thing I do want to point out is that between these plans, we are self-insured, which means this county pays actual claims. So when it comes down to the cost of a claim, this county pays that claim, and we do design our own plan. So everything from deductibles to services covered is a part of our plan design and is identical between the two options. So that part of it is entirely within the county's control. And so the quotes made are made on identical coverage options.
Okay, very good. Thank you. Mr. Baker, please. And I would like to ask the board if we could have Mr. Baker complete his presentation. You perhaps take notes, and then we can always reference back so he can present both options for your consideration. And then please, we'll open up the floor for any questions that you might have, and I'm sure there's going to be quite a few. So.
Oh, you're getting off easy, man.
Thanks, Madam Chair. So we did, we had the special cow meeting on 5/18, and then we had a follow-up meeting with HSC on 6/14. So after the 6/14 HSC meeting, I took the liberty on behalf of the county to ask Blue Cross Blue Shield and United Healthcare if there was any additional improvements they would like to do in lieu of the next meeting to make a decision. So there were a couple improvements that we sent out. Again, this slide 3 is all the insurance markets that we went to. There's a lot of names you won't recognize. Those are stop loss companies. I'm not going to spend a lot of time on this. So the improvement, if we look at the middle section for Blue Cross Blue Shield, it's in purple. What they did is if you go down to line 9, they increased the RX rebate guarantee another $100,000. So it's now $1,289,000. So Blue Cross improved $408,000 from their original offer to the county for the renewal for 24. In addition to the $100,000 increase in rebates, they added another $100,000 in credits for the county that will be taken off the January invoice of 2024. So now the credits are $375,000, resulting in a projected increase of 1.98%. So that's almost a 8% reduction from our starting point from Blue Cross's initial renewal. United Healthcare, they did not change their financial offer. They're comfortable with their financial position. They did listen to the concerns of the board. And so they did add a couple services that I will highlight. I'll go back. So they're including Smart Path Financial Counseling for employees. It's a online virtual financial counseling program. Estimated value is 10,000. They also would provide a on-site nurse 40 hours a week for the county to engage employees, assist with anything tied to the health plan, the wellness programs that the human resource department rolls out, and get your employees and their dependents engaged in all programs that are tied to the United Healthcare Kane County Employee Benefit Plan. So the estimated value of that nurse liaison is 140,000. And then they are providing their UHC rewards for engaging in the healthcare system, completing wellness goals. So really that would be designed with Jamie's team and the Assured Partners Wellness team. We work together on different programs, and there's a reward program that UHC could bundle together with healthy choices. So they're providing that as well. So those are the changes from what you saw back on June 14th. Any questions on the enhancements and the final offers?
Could you please present what Blue Cross has to offer with any
Yep.
additional enhancements?
And so Blue Cross has, they have their Well on Target program. So this is on their website, and we engage in some of the services today. And then they also have their Healthy Worksite consultation services. So we have looked at some of these in the past. So this is included as well within Blue Cross. The biometric screenings on this site, they don't cover the biometric screenings for free. They just have a service that we can bid out. So depending on if the county wants to go down that path, those are not included at no cost.
I have a question.
All right, yes, I'm reading everything here.
Oh, thank you.
Yes,
Does United Healthcare offer the cancer nurse specialist? I understand that Blue Cross seems to also give the option to talk with a nurse at any date, anytime. Would United Healthcare also offer the nurse cancer specialist?
Yes, they have different nurse programs for different conditions, whether you're diabetic, cardiac care, cancer. So yes, they have that as well.
and that's full coverage for any illness that you may have. The nurse, you call the nurse, so it's full coverage if.
Within both Blue Cross and United Healthcare offer nurse programs for chronic conditions. They do it slightly different, but they have that included. You have that in your current plan. United has that in their plan. And then in addition, United may be providing a on-site nurse to be housed where Jamie and her team feel fit on the county's premises.
Yes, Mr.
Are we
Tisch.
asking questions now, or?
Yes, we're asking questions. I think
Can-
the
Can
presentation.
we
is
go
done,
back to the
correct?
cost sheet about two or three slides before? I would like to point out when Blue Cross gave their renewal, that's what they offered. It was only after we went out to bid that they revised their offer.
Correct. So it was after they knew we were doing a full due diligence because they provided different claim files and for RX, the PPO, and certain HMO files. They delivered their initial renewal, and then once we had the results, then we shared those results and they revised their offer.
Okay. The nurse that United Healthcare is offering, we could have them in one location on Monday and a location on Tuesday. That would be up to us.
Correct.
Okay, thank you.
Any other questions? Yes.
Madam Chair, I'll come back to the same question I had. Why should we select and reject the other one? let the people who are insured, they decide what they do. We give them a benefit amount, say $25,000 or $30,000, and they have a cafeteria plan. They can go HMO, they can go to PPO of Blue Cross, they can go to dental, they can go to any, they choose whatever they like for that $30,000, and over and above, whatever they want to contribute is theirs. So this is being done, it's nothing new, it's not a new idea. That's how companies do it, and let the people decide. If I want to go to chiropractor, I want to choose one way. If I'm a cancer patient, I'll choose another way, to psychiatric another way. And let the people decide what their needs are.
Well, let's, Ms. Labrillo, can you answer that question?
Can I?
Oh, yes, Mr. Baker, absolutely.
So the offers you see from United Healthcare and Blue Cross Blue Shield would be pulled off the table if we said they could pick between United or the Blue Cross options. So they're underwriting the risk and providing the guarantees that they're giving based on the whole population. So the challenge with giving the employees a set dollar amount and letting them pick, Blue Cross would, who's going to stay in Blue Cross, who's going to go to United Healthcare? They would want to re-rate their offers because they can't guarantee who is going to take which plan, which condition. So that's the struggle with that. There is a vendor that we could look at called Gravy, and there's a couple others that you can put a set dollar amount. Employees can pick individual plans. The challenge with that is those plans are typically the exchange plans, which means the PPO network that you offer today, you cannot buy on the exchange as an individual. So there's, the concept is out there, but to have the network that the county has, you wouldn't be able to have access to that to accomplish that goal. So that would cause some challenges.
Thank you. All right. Yes, you may follow up on that. Yes.
I mean, these days, all these insurance companies, they offer plans on the website. My wife got Blue Cross Blue Shield plan, which is very similar to what the county had. And the price, which is not too far, actually better. So I don't know.
It is.
If they want to rework the price, that's fine. But
Yeah, the
that's
one
an
you
option.
buy on the individual exchange, though, is their select network. It's not the large PPO network that the county has. So there is a network difference on what Blue Cross sells on the individual market. You can get the same, you can get a similar deductible, but it's whatever Blue Cross gets approved by the state of Illinois for the exchange to sell on the individual market. Those are the options for 2023. Same for United Healthcare. So they can't completely match your current plans on the individual market, and you can't get the exchange plan. So.
And I can understand that. Are there any other questions?
Madam Chair Gums.
Oh, yes, Ms. Gums.
I think is my mic on? Okay. I have a series of questions actually. So, first of all, on both providers, do we have a definitive percentage of denial rates? I did some research on both companies. As you know, insurance companies also like to deny claims. That's something that is on my mind. It's important for me, so I would like to know if you got those numbers.
We did send those over to Jamie, right?
All of that information that was requested in the last meeting was sent out to the board. I can certainly go upstairs and print it and hand it out for everyone. But that was forwarded to the entire board shortly after the last meeting.
Yes, and was that, I got a number of 16.8, I believe, for Blue Cross, and it was a little fairly similar for the other one, but it was fragmented. So I wanted you to comment on that.
when they comment on their denial rates, understand that what services are covered and at what level is determined by the county, not the insurance company. So I think they both provided a pretty lengthy they provided a lengthy explanation about that number, which has to do with claims sent back for more information versus actual denials. Actual denials are quite low. There were cases where they requested medical records, so it's actually a pretty complicated answer to that question. That full-on denials are not common. Again, the services covered are the services covered. And there might be situations where they send them back for more information, and then ultimately those come back and then they get handled with the additional information and then paid on the second or third round if they are looking for additional information. But if you do need to see that information, I'd be happy to print it and hand it out, but it was forwarded by email to the board.
Yeah, it's more for the record because people need to know what we're doing here. Additionally, you said earlier that there would be, the plans are identical in coverage. So there is nothing different from Blue Cross and United Healthcare as far as the benefits or the coverages that our employees are used to now.
So let's define exactly the same, right? So
Let me narrow it down for you. So if I, under this plan that we have now, I don't have our medical, but let's say I get 20 visits to a psychiatrist. Under the new plan, do I also get 20 visits to the psychiatrist?
yes, so the process, the county self-funded with insurance to protect for catastrophic claims. So United Healthcare would take the certificates that Blue Cross has, and they would match deductibles, co-pays, out-of-pockets, coverages, what's covered and what's excluded. They line by line. So that would be matched. When we look at RX, we have a formulary list with Blue Cross Blue Shield.
Mhm.
That's a
Okay.
closed formulary. So there are current drugs that are excluded, and we have tiers of where the drugs fall. Blue Cross changes that list every year.
Right.
So whether you stay with Blue Cross or you move to United Healthcare, that list will be different in 2024. So if your drug moves from the lowest copay to the highest copay, the plan's the same, but the formulary list changed. And that's the current practice. An employee who doesn't understand how that formulary list is changed every January could deem that, well, it's not the same plan.
Okay, and I'm sorry, I'm not done yet. I did a lot of research on this and it matters a great deal to me, so thank you. Also, as far as the services that are provided, the availability of those services, are those diminished in any way from one plan to the next?
As far as with availability,
Are there less doctors for United Healthcare?
when we did our network match for the PPO, there was a 98.6% dollar match of in-network with United Healthcare for your actual charges. With Blue Cross Blue Shield, it was 99.66. So there's a 1% less of in-network dollars with United Healthcare. So it's very comparable.
Okay, thank you. And I did this research, so I do know the answers, but this has to be communicated. So during my research, during a Cubs game, I reviewed the reviews, right, of both companies. Because we can do that as Cubs fans. Because it matters to me what people think about their treatment and their customer satisfaction. So as a county, we don't want to buy into a program that is dissatisfactory across the board. I had found through my research, and this is my research only, that Blue Cross was highly rated and United Healthcare was not, comparably. The reason that this is important to me and, being rejected or having a claim denied for medical necessity, which is a really icky term. I'm not a fan of insurance companies. Sorry, Cliff. But when you have to identify what that medical necessity is and explain it while you're fighting cancer, it sucks. And nobody wants to do that. And I don't want to put that burden on our employees. And that's part of my decision-making process as well. So I would just convey that to everybody. That's my opinion on all of those things matter. Money matters, but our satisfaction by our employees matter too. And we want to make sure that if we can't pay them what they're worth, at least we can give them the benefits that they deserve. So I will be supporting Blue Cross and Blue Shield.
That's your last question?
It is.
Okay, very good. Ms. Bates?
Did we do any surveys of our current employees to find out what they would prefer?
That's Ms. Labrillo.
We asked the inmates.
No, we did not. As we discussed in a previous meeting, there are a lot of factors to weigh here. So I think that this is a really complicated issue, and to do a survey would not take into account the full understanding of the differences between the plans, the differences in the funding needs, the budgetary impact. So there's a lot of moving parts to this. And we did not poll the staff. So we did talk about that in a previous meeting and determined not to poll the staff.
And this is truly a board's decision. As much as we'd like to get employee input, this is a board decision on which way to go because of the financial repercussion.
I just want to follow up. The one public comment that we received said many of the things that I wanted to say, so I will try not to repeat her. But I was a licensed acupuncturist for 20 years, and my patients who had Blue Cross Blue Shield were always in a better position than my patients who had United Healthcare, either for deductibles or for treatments per year allowed, or just in what I got paid. So whether or not I wanted to take those patients. So I will be voting with Ms. Gums for Blue Cross Blue Shield as well.
Clarify the deductibles and number of covered treatments and types of treatments covered is part of the Kane County plan design and would be the same from one plan to the next.
Okay, thank you.
Linda, again, you know, there's a perception out there that Blue Cross Blue Shield is number one. It's aces. It can't be beat. I don't know that perception is true. I know, for instance, that United Healthcare has cleaned up its act over the last several years. They're doing a lot better in the public domain. However, perception is important. And to the extent that our employees believe that we're giving them number two, when we have a problem with retention of employees and so forth, I think it's a real concern that we not let perception color what people think about their job. I'm worried about that.
Thank you. Mr. Tepe, you've had a couple of comments, so let somebody else speak. Anybody else over here? I understand, Mr. Roth, I see. Yes, Ms. Molina.
Thank you, Madam Chair. I guess even though we know it's a board decision, I really would have wished that we had some employee input on this. We don't provide employees a lot of input on what their benefit levels are, but when they look at their application to, become an employee of King County, I think healthcare benefits is on the top of a lot of people's lists. The fact that now we are able to provide health insurance within 30 days of employment, I think is great. I think that's going to be pulling a lot of people from other, areas here, but as someone who works with health insurance every single day and understands what Ms. Gums goes through and tries to be, someone to advocate for our patients. I have to say, as much as I don't like Blue Cross, as much as I don't like United Healthcare, the perception is there, and it is actually real. I mean, Blue Cross does provide better coverage. Providers will look at it and, say, oh, you have Blue Cross, you have a better health insurance plan. Same thing with dental insurance. I asked a dentist I know recently about the two options for dental care, and he said the other option was garbage. So as much as it brings us, as much as we know this is a financial decision, there's also a perception. And I think there's a way of us to look at our employees and say, we hear you and we stand with you and we understand what your concerns are. And we don't want someone who is, standing at the edge of, their cancer treatments to decide oh, sorry, we saved $2 million. So now you can't have the cancer treatment that you've been planning for the last 6 months because your insurance plan has changed. So, you know, I understand the financial savings, but I will also be voting to continue with our current insurance plans. Thank you.
Just if I may just respond.
Yes.
Sir, just Mike and Jamie. And Miss Molina, I'm not picking on you in any way, shape, or form, but specific to that comment, I thought that we addressed, because I don't want any of our staff to ever feel that if you had something chronic going on, that could be pulled away. What options were available for that?
And Mr.
Because-
Sturgis, this is a crystal ball here option, right? Right now, we might know what some people's options are, but you know, in November, December, that might have changed.
That's the best I can do.
And I understand what you said
Best I can
because I've been listening to the county board meetings and to your committee meetings. So I understand that anybody right now who is in that coverage level will be covered with regardless of choices, but we don't have a crystal ball for what's happening in the
Understand, I
future.
just don't
So
want the perception to ever be that we are pulling out the rug from under somebody, because we are so far paradigm opposite of that in what we've tried to do to go apples to apples. And
Understood.
again, I'm not advocating for one versus the other. I'm just kind of saying.
I've been consulting since 2003. We work for our clients, not the insurance companies. I've had claim issues, claim denials with Blue Cross, with United, with Aetna, with Cigna, with every insurance company. It's a complex industry. Those issues and denials come from many reasons. We sit on your behalf. We have services. We make sure that everything that should be covered is covered. The disruption and the savings that United Healthcare is presenting is not because they would withhold cancer treatment. Your plan, you design your plan as a county. There's disruption and change. Healthcare is complicated. It's complicated to change from United Healthcare to Blue Cross and vice versa. So it is a complicated system, but just our job as your consultant is to make sure that if you were to make a change, everything that is covered in your plan is covered with the new provider. I can't make every doctor stay in network. So that's a different thing than what's covered. It's just where you're choosing to access care.
And if I can just make a comment to Ms. Molina, I've done my own internal survey.
Speak up, please. Speak up.
And my own
Speak up,
documents.
please.
I've done my own internal survey, but unless I am asked to vote because of a tie, I don't want to share that. But
Mr. Shipro.
I think it's an important thing to do, to
Point of
ask.
order, Madam Chair.
Yes.
I believe there was some discussion about the chair weighing in
The
prior
chair-
to a tie vote.
Yeah, only for a tie, and I mentioned that. And I just said that I've done an internal survey.
Okay.
Madam Chair, Tepe here. Is there a difference in the cost for an extended family plan between the two plans? Ways?
Define extended family plan.
Well, I mean, if insure the employee, but what is the cost of insuring the family? And is there a difference between the two plans, or is that the same?
So we assured partners and Jamie with HR and finance, we work together based on your claim projections by plan design to create the rate structure to fund the plan expense. So that the ratios would stay exactly the same. So there's no difference as far as Blue Cross's ratio. We're setting the funding rates.
Okay.
Okay, so I think we've asked quite a bit of questions.
I
Last
have-
one.
I have a
Comment. I
statement.
haven't made a
Oh,
comment yet, but
Okay, yes, sir.
I don't extend it any longer. I think I was looking 4 years ago or so when we reviewed this last, we voted to have Blue Cross over UHC. And there was a significant price difference then as well. We're facing the same kind of thing. And I think you've done a wonderful job in having Blue Cross, if you compare Blue Cross to what we're asking for, they brought them from a 9.85% to a 1.98%, which means that our cost year over year is just about 2%, right? When the everything else has gone extremely high, much higher. So with the great job that you've done, I think that if we follow the same choice we made 4 years ago or whenever it was, we would then choose, I think that, and in my mind, the 2% increase over what we've been paying is an extremely good rate. I understand that United Healthcare has a lower rate, but we made that choice again 4 years ago to pick the Blue Cross versus the same, and we're only getting a 2% increase on this one. So it seems that if we want to keep consistency, 2% increase seems reasonable.
Okay, thank you. Thank you, Mr. Caius. Yes, ma'am.
Thank you. It's been quite a hot seat, the past few months or what have you, that we've been deciding this, or voting on this decision. Thank you, Madam Chair, for affording us the ability to move forward, for trusting us to make these decisions. I couldn't have chosen a better committee to do that. Mr. Surges, your guidance, Mr. Baker and Ms. Lobrillo, you've done a phenomenal job. So to staff, I want to thank you for all your efforts and work for the benefit of the county. I understand and have heard your stories, your healthcare stories, your statements, and the things that you've wanted to share. But at this moment, I will be abstaining from this vote today because after careful consideration and with the guidance of fellow board members that I trust and respect, as well as some advice from the state's attorney, I'm going to abstain because I feel that it is the best option for the county at this time. Thank you so much for allowing me to give my opinions.
Thank you. If there's no other questions? So how do we proceed? Because I believe we have two options, correct? So do we bring?
So Gums, I'll make a motion to, wait. I'll make a motion. Is it resolution 23317 for Blue Cross? Is that accurate?
Okay.
Blair, could you bring up the resolutions that are in the packet?
Thank you.
So to their 23317 is for Blue Cross.
I'll move that.
Paid second.
Thank you. Do you have it, 23? All righty. All right, clerk, please call the roll.
Discussion.
Discussion, my apologies.
Just
Discussion.
confirming that 317 is a vote affirming Blue Cross to remain.
Confirmed, clerk?
That's just a place marker. You just want to make sure that you're saying for Blue Cross, both of them are under the same
That's what I
resolution number.
thought.
So
2317.
So my motion will reflect that it is 317 for Blue Cross.
For Blue Cross.
Very good.
All right.
Okay.
Paid seconds.
Okay, okay. Okay, so you're taking a vote on Blue Cross coverage discussion.
I want to make sure that a vote yes is voting for Blue Cross.
That's accurate.
Thank you.
Madam Chair, I also have one amendment.
An amendment to
Can I
the,
do that now?
to the
For
resolution.
Therefore, I'd like to make an amendment on page 14. It reads, now therefore be it resolved that the chair of the county board is hereby authorized to sign agreements consistent with the terms set forth herein. I would amend that language to read, now therefore be it resolved that the King County Board authorizes and directs the chair of the King County Board to sign the agreement within 30 days consistent with the terms set forth herein.
I would
Second the
turn this-
amendment.
would turn this over. Yes, Mr. Linder, I would turn this over to Lobrillo. Could we?
Did we have a second or not?
I'll second.
Linder already seconded. Could you read that again?
Absolutely. It's just some cleanup language. It says, now therefore be it resolved that the King County Board
Is it not by the, but it's that the?
by the. I just scribbled it here, but the intent is to include King County Board authorizes the county chair to sign agreement within, correction. Now, strike that, reverse it. Starting again, Now therefore be it resolved by the Kane County Board. No, that's not correct either. I wrote it right. Now therefore be it resolved that the Kane County Board authorizes and directs the Chair of Kane County Board to sign agreements within 30 days consistent with the terms set forth herein.
I have a concern that those will not be ready within 30 days. They often take us into October. We go through civil vetting and there's an entire process associated with those contracts. I believe a 30-day time limit on that would not be administratively feasible.
Okay. If we could get the state's.
He's coming up.
Oh,
He's coming
there he
up.
is.
It also requires the Blue Cross Blue Shield to draft those contracts and send them to us. In a normal year, we pass a resolution like this about this time of year. We usually get those contracts signed in October.
As far as the substance of the direction, there's no problem with that issue. In regards to what Ms. Labrillo brought up, I would agree with that. I would leave the language open-ended enough that would allow for contract vetting as well as negotiation, as long as it's within the confines of the resolution. And you can basically say negotiations can be restricted, to whoever you want it to be, SAO, HR, under the guidance direction with the Madam Chair, however you'd like to do it. Just as long as it's left open-ended such that we're not a gun to our head of a deadline.
Right. Yes. Yes, please.
If the motion.
I can barely hear you.
Microphone, please.
The motion.
Is it on? Not on yet.
That one's very dead.
Is a very bad.
Here.
You can hold that one right there.
All right, good.
There you go.
Okay. Well, I needed something that says CBS, NBC, ABC. The question is if the motion said as presented by Mr. Gums, but instead of within 30 days, if it said something like within 30 days of presentation of a final contract.
By the SAO or however you'd like to frame it, that would be fine.
I would, yes.
Okay.
I'll,
And we can change the resolution if the amendment is authorized by the board before obviously signature of the resolution. So that shouldn't be a problem.
So we should change it now and we can then vote on the amended resolution because that's just so we can get.
No, you need to vote on the amendment first. It's a trumping motion that would trump the lower. So you need to vote on the amendment, and I'll defer to our parliamentarian, but my understanding would be is that you need to vote on the amendment first, up or down, and then get to the actual question at hand.
Can the clerk read back the amendment, please?
With the
change.
Change. Okay.
Have it?
Well, I'm getting it as far as whereas the King County Board authorizes and directs the chairwoman to sign the agreements within 30 days of presentation of final contract consistent with the terms set forth herein.
Good.
Work, Mr. Chaperone?
Yeah, that'll work.
That good with you?
that is good with me. Yes, thank you.
Okay, and who seconded? Was
Oh,
it
Linder.
Linda, right? Okay, let me get rid of that.
All right, so now
I need more discussion on.
we have discussion on the amendment and we had a second on the amendment,
I
correct?
believe Mr. Lindner.
Linder.
Mr. Linder again. All right, very good. So is there any discussion on the change of this language to the amendment? Yes.
Is that, are you just trying to be more precise?
Correct.
Doing that? Okay.
Yes. That the Kane County Board does have the authorization to authorize me.
Right.
The chairman.
And just, I think it should be consistent.
Yes, sir.
Frank SAO, just so we're clear, the language that's being added is they're directing. So the county board has the authority to authorize and direct the county chairwoman. So that is the particular substantive amendment that you will be considering, just so that everybody's on the same page with this.
And I can assure you that the county board chairwoman has no intention of not allowing insurance for our employees. All right, is there any other discussion? Okay, so clerk, we are going to vote on the amendment.
Yep. Okay. Ellen?
Alan, I.
Bates?
Bates, yes.
Berman?
Berman, yes.
Doherty?
yes.
Gavest?
Davis, yes.
Ford? Gums?
Gums, yes.
Iqbal?
Iqbal, yes.
Juby?
UBI.
Kenyon?
Yes.
Caius?
Guys, yes.
Leonard's not here. Lewis?
Yes.
Linder?
Yes.
Molina?
Molina, yes.
Roth?
Roth, yes.
Sanchez is not here. Silva?
I'm going to abstain.
Okay. Strathman?
Yes.
Surges?
Abstain.
Okay. Tarver?
Tarver, yes.
Tepe?
No.
Williams?
Yes.
And Young?
Yes.
Okay, that passes with one nay.
Pissed.
That was the amendment. Now we have to vote on the entire resolution.
Can I get clarification, Mr. Tepe? You are voting nay, correct?
That's correct.
Okay, just want to make double
No on
check.
the amendment.
Do we need a fresh motion now as amended, or does the original one?
Now stand. Where it now stands is that the amendment has been adopted
Mhm.
and discussion is still open unless there is no further discussion.
Call for the question.
Thank you, Dale.
Is there any further discussion? He called the question. Clerk, please call the roll on the amendment, and please, you are voting on Blue Cross.
We have to call the question.
Well, if the question can be called for if there is nobody who wishes to continue to speak, then the chair may,
We get tripped up on this occasionally.
Yes.
So when somebody says call the question, we don't have to vote on that.
well, wait. You don't have to, if there is nobody else who wishes to speak, then the chair may then call the question without a vote. If somebody wishes to speak and there is a second to the call of the question, then you have to vote on calling the question.
Thank you.
Okay, and.
Which would end the discussion.
Correct.
Yeah.
And I asked if anybody had any other comments. And see anything. So ladies and gentlemen.
The
are
chair
you-
may also order the question if, when calling for a discussion, there is no further discussion.
Thank you.
So I'm asking, is there any further discussion for the second time? And you are voting upon Blue Cross.
Correct.
You are voting on the Blue Cross motion as amended.
As
Yep.
amended. Thank you, sir.
I have one more question.
Yes, ma'am.
If this should lose, does that automatically?
No.
turn- Okay,
Are you now ready?
yes.
Okay, please, clerk, please call the roll.
Ellen?
Alan, I.
Bates?
Bates, yes.
Berman?
Berman, no.
Doherty?
Yes.
Gavest?
Davis, yes.
Ford? Gums?
Gums, yes.
Iqbal?
Iqbal, no.
Juby?
UBI.
Kenyon?
Yes.
Caius?
Guys, yes.
Lewis?
Lewis, yes.
Linder?
Linda, yes.
Molina?
Molina, yes.
Roth?
Roth, yes.
Silva?
Silva abstains.
Strathman?
Yes.
Surges?
I need to abstain.
Stain? Right.
Abstain.
Tarver?
Tarver, yes.
Tepe?
Tepe, no.
No. Williams?
Williams, no.
Young?
Young, yes.
It passes.
So what was?
4 nays.
4 nays,
Mhm.
2 abstain.
Yep. The rest is history.
Okay, 2 abstain. And 15.
We're done. I am.
Leonard was here in Sanchez.
More than enough.
Okay, all right, very good. Okay, Blue Cross Blue Shield, and now we're on to the dental providers. I need may I have a motion to approve item number 23-318?
So motion.
Madam Chair, my Surges, my question is, on the agenda, it's under consent agenda item. So technically,
Oh, you can do both.
or you can do both. Ken, I guess I'm forwarding this to you or one of the state's attorneys. Do you want this?
I think we should probably,
I
yes.
think you should note that they are.
Just do this right, is all I'm saying. Yeah.
We're taking a vote individually. All right, are we all good? Okay, so we have Ms. Lewis is moving it. We do not have a second.
Point of information, are you moving for Cigna or for Sun?
For both right now, because they're both under both.
There is an agenda item to authorize the provider. It would be up to the move-in to specify who the provider is.
That's it.
Okay.
That's it.
Then I will authorize Cigna as Kane County's dental provider.
Okay, thank you.
Tina will second.
Who seconded?
Molina.
Thank you.
I said, yeah.
Oh.
Seconded, yeah.
Okay, I'm sorry. Okay.
He was right here.
Motion and a second to authorize Cigna as the dental provider. Is there any discussion on this? Yes, Mr. Hill.
Is Cigna the current supplier that we have now?
It is.
Okay.
Ms. Liberilla, you please, you may want to just stand up here as this discussion, or Mr. Baker to be ready to answer any questions. Thank you.
I would like to make an amendment. Gums, Madam Chair.
Yes, Ms. Combs.
Thank you. I would like to make the same amendment. I'll repeat it.
All right, so we're going to have a motion and a second to amend the resolution.
Yes, and I'll repeat it for you all. Now therefore be it resolved that the Kane County Board authorizes and directs the Chair of Kane County Board to sign agreements within 30 days of presentation of contract. Presentation of contract. I scribbled bad. Consistent with the term set forth herein.
Second, Linder.
Is there a second?
Mr. Linder.
Oh, I'm sorry, Mr. Linder, of course. Is there any discussion on this? Seeing none, clerk, please call the roll. This is on the amendment to the resolution. Similar to the previous.
Correct.
Amendment.
Okay. Ellen?
Ellen, I.
Bates?
Yes.
Berman?
Yes.
Doherty?
Yes.
Davis?
Yes.
Ford?
Ford, yes.
Gums?
Gums, yes.
Iqbal?
Iqbal, yes.
Juby?
Juby, aye.
Kenyon?
Yes.
Caius?
WS.
No, what, hang on. Who seconded this amendment? I'm sorry.
Linder.
Linder. I'm putting in the wrong one. He's not here. Lewis. Lewis, yes. Linder,
Yes.
Molina,
Molina, yes.
Roth.
Roth, yes.
She's not here. Silva.
Silva's going to abstain.
Okay. Strathman,
Strathman, yes.
Surges,
I think I can vote, yes.
Carver.
Tarver, yes. On this one, yeah.
I'm sorry, Carver. Okay.
No.
Tebby,
No.
Williams,
yes.
Young.
Yes.
That passes.
Okay, and Williams was a yes, correct?
Correct.
Okay, very good. All right,
Let's see, I got-
now we're back. Is there any discussion on this provider?
Madam Chair, the point of clarification, the resolution or the draft in the package mentions United Healthcare, but you mentioned Cigna. So, what are we voting on?
Dental insurance. Dental insurance.
Cigna.
Cigna? Oh. So is this on page 16 or what page
On
is it?
page 25 right now in your packet.
Yeah, it's between Cigna and Sun Life.
Okay,
23-318.
okay. Oh, okay, this is for the dental.
Frank's here. Are there any questions on this dental provider? Seeing none, clerk, please call the roll.
Just for clarification, this is going to include the amendment we just voted upon
And we're.
As amended.
the health-
as amended.
Del-
There you go.
Cigna as amended. Okay, Ellen.
Alan, I.
Bates,
Bates, yes.
Berman,
Yes.
Doherty,
Yes.
Gavest,
Yes.
Ford,
Board, yes.
Gums,
Gums, yes.
Iqbal,
Yes.
Zuby,
Juby, no.
Kenyon,
Yes.
Caius,
Guys, yes.
Lewis,
Lewis, yes.
Linder,
Linda, yes.
Alina,
Molina, yes.
Roth,
Roth, yes.
Silva.
So abstains.
Okay. Strathman,
Yes.
Surges,
Burgess, yes.
Tarver,
Tarver, yes.
Tepe,
Except no.
Williams,
Williams, yes.
Young.
Young, yes.
Passes.
To be. No, I think. Got two no's. No's. Okay. Okay, very good. All righty, we are now into some other items regarding a tax agent. May I have a motion and a second to discuss and potentially approve item number 23-315?
Silva moves.
One second.
Would second?
Mr. Iqbal seconds. Discussion. Yes.
So I still don't know. Does this mean we took property for back taxes and now we're selling it? I still don't know what this means.
I'll bring up our state's attorney. Is he here?
Oh, you weren't paying attention, were
I did.
you?
Okay, please.
Just separate and legal action. That's why we can't understand.
He's,
Are you threatening me a legal action here?
would you like a parliamentarian? He feels he's got expertise in this.
No, feel free to, well, what's the specific question? I apologize. I was talking.
Is, I believe, what is this? Does this mean that we took the property and now we're selling it?
Yes, so we reached out to the tax agent. This is routine stuff that I believe you guys have passed in the past. All they're essentially asking for, to my understanding, is that they want to sell the property so that they can get it back on the tax roll. So the lien essentially is being sold.
So basically, what happens is that the property is sold at the regular tax sale. But there are some properties that either aren't bid or are for either because there are no bids or there's something else wrong with it. And at that point, and these are often things like the median strip in somebody's, subdivision. And so the tax agent then has a further proceeding where they find people either who will buy them or take them. And as Mr. Frank says, then they are put back on the tax rolls.
Yes, Mr. Linder.
I'm sorry, is this a blanket authorization or are we talking about specific properties at this point?
I believe that this should authorize conveyance of specific property.
Just these two that are listed, okay.
That is correct.
It is a specific property and that is attached in the agenda.
I believe the tax agent that we use is used by 98% of the counties in the state. When I first was involved, we did it ourselves, which is not really a good thing.
Does that answer your question, ma'am? Yes, okay. Are there any other questions to this? Seeing none, clerk, please call.
Madam
Oh,
Chair, just
yes.
a point of clarification. I think there was some confusion last time. But as I see is the statute is listed here. So if we had read this thing during the last meeting, it would not be here again. So I think that's my clarification. I mean, some people were very adamant about rejecting the thing, tabling it, postponing it, as if it was something really bad, but it is something statutory that we are doing.
Here to do. Yes.
Correction, I asked for it to be postponed because no one in the room could explain to me what we were voting on. It wasn't, wasn't trying to be negative about it. I'm just not going to vote on something that I have no idea what it is. That's why it's back.
All right. With that clarification. Seeing nobody else's hands up, clerk, please call the roll.
Ellen,
Alan, I.
Bates,
Yes.
Berman,
Berman, yes.
Doherty.
Doherty, yes.
Thank you. Davis,
yes.
Ford. Gums. She's gone. Iqbal,
Iqbal, yes.
Juby,
yes.
Kenyon,
Yes.
Caius,
Yes.
Lewis,
Yes.
Linder,
Linder, yes.
Lena,
Yes.
Roth,
Roth, yes.
Silva,
Silva, yes.
Strathman,
Yes.
Surges,
Yes.
Tarver,
Tarver, yes.
Tepe,
Deputy, yes.
Williams,
Williams, yes.
Young.
Young, yes.
That passes.
May I please have a motion and a second to approve item number 316-23-316?
Williams moves.
Thank you, Mr.
I have a
Williams.
second.
Thank you, Mr. Davis. Seconds. Is there any discussion on this? Seeing none. Clerk, please call the roll.
Okay, and this is for 23-316. Allen,
Alan, I.
Bates,
Bates, yes.
Berman,
Berman, yes.
Doherty.
Doherty.
I'm sorry, you didn't come through clear.
Doherty, yes.
Thank you. Davis,
Yes.
Ford,
Ford, yes.
Gums,
Yes.
Iqbal,
Iqbal, yes.
Juby,
I.
Kenyon, Caius,
Yes.
Lewis,
Yes.
Linder,
Yes.
Lena,
Molina, yes.
Roth,
Roth, yes.
Silva,
Silva, yes.
Strathman,
Strathman, yes.
Surges,
Surges, yes.
Tarver,
Tarver, yes.
Tepe,
Deputy, yes.
Williams,
Williams, yes.
Young.
Young, yes.
That passes.
All right, very good. May I have a motion and a second to approve item number 23-319?
Molina moves.
Tarver, seconds.
Thank you both. Is there any discussion on this item? Seeing none, clerk, please call the roll.
Helen,
Alan, I.
Bates,
Bates, yes.
Berman,
Yes.
Davis,
Yes.
Doherty, I'm sorry, Doherty.
I noticed that. Yes, I'm a yes.
Okay, and Mr. Davis was also a yes. Ford,
yes.
Yeah.
Yeah, he did it 2 times. You only can vote once. though.
okay. Gums,
Gums, yes.
Iqbal,
Yes.
Juby,
I.
Kenyon,
Yes.
Caius,
Yes.
Lewis,
Yes.
Linder,
Linder, yes.
Lena,
Molina, yes.
Roth,
Roth, yes.
Silva,
Yes.
Strathman,
Yes.
Surges,
Surges, yes.
Tarver,
Tarver, yes.
Tepe,
Yes.
Williams,
Williams, yes.
Young.
Young, yes.
That passes.
Very good. I have to ask, is there any public comment off agenda? I do not. Do not.
Yeah.
There are Kane left, as you.
Kenyon, jump in.
Can I,
I move we adjourn till August 8th. Is this your birthday? Tomorrow morning. I got 6 hours.
All right,
Moving
so
on.
we have,
Contract on him.
we have a motion to adjourn. All in favor?
Aye.
Aye. Very good. Thank you.